Good day, everyone. So, we are the group 10. So, our topic is depressive disorder. So, the reporter is me, Asnair Gia Hapil, and uh, Biner Jana Alamada, and then Eliza Mayasa. So, ang depressive disorder is may mga type siya. So, may mga type siya na disorder. So, include dito yung disruptive mood dysregulation disorder, depressive disorder due to another medical condition, major depressive disorder, persistent depressive disorder, other specified depressive disorder, and then premenstrual dysphoric disorder, and substance medication induced, and for last sa depressive disorder is unspecified depressive disorder. So, yun yung mga type na na-include sa depressive disorder. So, let's proceed sa main discussion of depressive disorder. So, let's proceed sa disruptive mood dysregulation. So, the common feature naman ng depressive disorder is sad, empty, or irritable mood, and clinically significant associated symptoms. So, yun yung yung common feature ng sad, empty, and irritable mood sa depressive disorder. So, what differ is the duration. So, maano lang siya, yung different lang ng mga disorder na to is yung timing, and then yung duration ng yung mga yung criteria or yung mga common feature is yung duration lang niya, and then yung timing and presumed etiology. So, let's proceed sa disruptive mood dysregulation. So, disruptive mood dysregulation disorder, so DMDD, so is a mental health condition that cause chronic and intense irritability and frequent anger outbursts in children. So, itong disruptive mood dysregulation disorder is parang makita lang siya sa children up to 10 to pataas. So, hindi mo siya ma-diagnose if 10 below pa siya. So, dapat 10 pataas yung edad ng bata. So, it is intense irritability. Itong disruptive mood dysregulation disorder is intense yung irritable ng isang tao or ng bata or ng adolescent. So, and frequent anger naman. So, frequent yung anger niya. Yung anger outburst ng merong disruptive mood dysregulation. So, let's proceed sa diagnostic criteria. So, sa diagnostic criteria naman, you cannot diagnose people if hindi mo siya ma-diagnose if hindi ma-meet yung diagnostic criteria ng disruptive mood dysregulation disorder. So, first, letter A of diagnostic criteria is A, severe recurrent temper outburst manifested verbally. So, example is verbal rages. So, ang isa sa diagnostic criteria na ma-meet dapat ng merong disruptive, para ma-diagnose ang isang tao na merong disruptive mood dysregulation disorder is yung yung temper outburst niya is recurrent. So, example dito is yung verbal rages or behaviorally. So, example dito yung sa behaviorally is physical aggression toward people or property. So, yung physical aggression niya is toward people or property. So, that are grossly out of proportion and in intensity or duration to the situation or provocation. So, di ba kanina is ang kaibahan lang talaga ng ibang disorder is yung duration ng ng criteria ng mga symptoms nila. So, B, the temper outbursts are inconsistent with developmental level. So, ang temper outburst naman, bago mo ma-diagnose ang isang tao, is yung temper outburst dapat niya is inconsistent with developmental level. So, C, the temper outbursts occur on average 3 or more times per a week. So, di ba, bago mo ma-diagnose ang isang tao na may DMDD is yung temper outburst niya is mag-occur lang siya on average or 3 or more times per week. So, the mood between tempers outbursts is persistently. So, persistent dapat yung irritable or angry niya most of the day or nearly every day and is observed by others. So, dapat yung temper outburst ng bata is ay yung mayroong DMDD is persistent, irritable, or angry most of the day or nearly every day. And observable dapat to siya ng parents niya or teachers and peers. So, criteria A, they have been present for 12 or more months. So, throughout that time, the individual has not had a period lasting 3 or more consecutive months without all of the symptoms in criteria A day. So, sa E naman is, ang criteria A, they have been present for 12 or 4 months. So, throughout that time, yung A to D is the individual has not had a period lasting 3 or more consecutive months without all of the symptoms in criteria ED. So, sa letter F, criteria AD are present dapat at least 2 of 3 settings. So, dapat yung criteria A and D, dapat present siya sa 3 settings, which is home, school, and peers. So, and are severe and at least one of these. So, G, the diagnosis should not made for the first time before age 6 years or after age of 18 years. So, the diagnosis hindi siya dapat ma-made for the first time before age 6 years or after age of 18 years. So, letter H naman sa diagnostic criteria is, by history or observation, the age at onset of criteria AE is before 10 years. So, di ba? 10 years muna yung, dapat observation mo muna before 10 years, for 10 years. Di ba? So, letter I, so, there has never been a distinct period lasting more than 1 day. So, during which the full symptom criteria, so except duration for a manic or hypomanic episode have been met. So, dito dapat na-met yung episode, tapos hindi wala siyang distinct period na mag-last talaga yung symptoms or yung yung pagiging irritable ng bata o yung outburst ng bata. So, ang note lang dito sa diagnostic criteria ay letter I. So, note, developmentally appropriate mood elevation such as occurs in the context of a highly positive event or its anticipation. So, should not be considered as a symptom of mania or hypomania. So, yun yung note ng letter I. So, G. So, the behavior do not occur exclusively during an episode of major depressive disorder and are not better explained by another mental disorder. So, for example, dito is dapat yung the behavior dapat siya do not occur exclusively during sa major depressive disorder. So, ang major depressive disorder is another disorder ng depressive disorder. So, dapat ma-explain siya ng another mental disorder. So, which is autism, spectrum disorder, and post-traumatic stress disorder, separation anxiety disorder, and persistent depressive disorder. So note lang nito sa letter G, no, is like, this diagnosis cannot coexist with oppositional defiant disorder. So, intermittent explosive disorder or bipolar disorder, though it can coexist with others, including major depressive disorder, attention deficit hyperactivity disorder, conduct disorder, and substance use disorder. So, individual whose symptoms meet criteria for both disruptive mode dysregulation disorder and oppositional defiant disorder should only be given the diagnosis of disruptive mode dysregulation disorder. So, if an individual has ever experienced a manic or hypomanic episode, the diagnosis of disruptive mode dysregulation disorder should not be assigned. So, sa letter key of the diagnosis criteria ng disruptive mode dysregulation disorder is the symptoms are not attributable to the physiological effects of a substance or to another medical or neurological condition. So, dapat wala siyang are not attributable to the physiological effects of a substance or to another medical or neurological condition. So, ang symptoms dapat ng DMDD is not attributable to the physiological effects. Tapos, so yun yung diagnostic criteria ng DMDD. So, before na masabi mo na yung bata, yung adolescence is may DMDD, is dapat ma-meet niya lahat yung diagnosis criteria. Kasi, we cannot know kasi baka iba yung disorder niya. Dapat ma-meet niya talaga yung diagnostic criteria ng DMDD. So, we have here the causes of disruptive mode dysregulation disorder. So, so DMDD is more severe and longer lasting. So, which is the causes of disruptive mode dysregulation disorder. So, such factors may include such factors may include sa causes of disruptive mode dysregulation is the exact causes of DMDD are not clear. Though there are a number of a factor that are believed to play a role. So, such factors may include genetics. So, genetics, yung causes ng DMDD, pwede siya maging genetics. Kaya, nagkakaroon siya ng DMDD. Temperament. So, ang temperament naman is refers to personality traits that determine how someone reacts to the world. So, yan yung temperament. So, co-occurring mental conditions and childhood experiences. So, yun yung causes ng DMDD. Mental conditions and childhood experiences. So, we have naman here treatment of disruptive mode dysregulation. So, psychotherapy. So, talk therapy. So, psychotherapy also called talk therapy. So, is a term for a variety for a treatment techniques that aim to help a person identify and changes of unhealthy emotion. So, thought and behavior. So, psychologists and psychiatrists lang dapat ang maka-undergo ng psychotherapy because they are mental health professional and they have license. So, it can provide support naman ang psychotherapy. It can provide and support education guidance to your child and your family to help them with DMDD. Pero parang yung psychotherapy or talk therapy is pwede maka-help din siya sa education mo and then sa family mo. Like mag-talk kayo and in your family and ganun. So, if hindi naman ang psychotherapy is meron pang another treatment ng DMDD. So, which is medications. So, let's proceed so we have different types naman ng psychotherapy that may help to DMDD. So, include dito yung cognitive behavioral therapy and dialectical behavioral therapy and parental learning. So, let's proceed yun ang treatment ng disruptive mode dysregulation and therapy. Comorbidity naman nito is ng DMDD is yung rates of comorbidity and disruptive mode dysregulation disorder are extremely high. So, it is rare to find individuals whose symptoms na ma-meet yung criteria for DMDD. So, comorbidity between disruptive mode dysregulation disorder and other disorder ay other DSM defines syndromes appear higher than for many other pediatric mental illnesses. The stronger overlap is with oppositional defiant disorder. So yung parang may kasimilarity ang defiant disorder and DMDD. So not only is the overall rate of comorbidity high and disruptive mode dysregulation disorder, but also the range of comorbidity illnesses appear particularly diverse. So these children typically present to the clinic with a wide range of disruptive behavior, mood, anxiety, and even autism spectrum symptoms and diagnosis. So, however, children with disruptive mood dysregulation disorder should not have symptom na that meet criteria for bipolar disorder. So, pag ang DMDD is mamit niya yung symptom or ng criteria ng bipolar disorder is magkalituhan or magka-problema. So, if mahirap siya alamin if mayroon siyang bipolar or DMDD. So, if children have symptoms that meet criteria for oppositional defiant disorder or intermittent explosive disorder and disruptive mode dysregulation disorder, only the diagnosis of DMDD should be assigned. So, yun nga, if meron siyang may meet niya yung criteria ng oppositional defiant disorder, ang DMDD lang na diagnosis criteria dapat ang ma-defined, ang should be assigned. So, also, noted as earlier that the diagnosis of DMDD disorder should not be assigned if the symptoms ng DMDD occur only in an anxiety-provoking context. So, when the routines of a child with autism spectrum disorder or obsessive compulsive disorder are distributed or in the context of major depressive episode. So, you cannot assign if the symptoms occur mag-occur lang siya only in anxiety provoking context. So, you cannot assign the DMDD if yung anxiety is mag-provoke lang siya sa provoking when the routines of child of autism spectrum disorder. So, parang hindi mo ma-assign ang diagnosis criteria ng DMDD if yung anxiety is the provoking context lang. So, that's the disruptive mode dysregulation disorder. So, let's proceed sa depressive disorder due to another medical condition. So, ang depressive disorder due to another medical condition is a mood disorder. Diagnosis is where there is a prominent and persistent period of depressive mode or markedly diminished interest, pleasure, thought to be related to the direct physiological effects of another medical condition. So, ang risk factor nito is yung stroke or Parkinson disease, like, 'di ba, is kasi yung mga medical condition na to is mag-lead siya sa depression. So yun yung depressive disorder due to another medical condition. If para ma-meet yung depressive disorder due to another medical condition is dapat ma-meet niya yung diagnostic criteria ng depressive disorder due to another medical condition. So, A prominent and persistent period of depressed mood or markedly diminished interest or pleasure in all or almost all activities that predominates in the clinical picture. So, B. There is evidence from the history or physical examination or laboratory finding that the disturbance is the direct pathophysiological consequence of another medical condition. So, dapat, pag bago ma-meet yung criteria ng para masabi na you have depressive disorder due to medical condition is dapat na may evidence na from the history of physical examination and laboratory findings. So, letter C is so the disturbance is not better explained by another mental disorder. So, adjustment disorder with depressed mode and which the stressor is a serious medical condition. So ito yung sa letter C is yung ginasabi dito is yung disturbance is not better explained by another mental disorder. So, dapat yung disturbance ng isang tao na may medical condition na nag-lead into depressive disorder is dapat hindi siya ma-explain to another mental disorder. So, D, so the disturbance does not occur exclusively during the occurrence of delirium. So, E, the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So, bago mo masabi na she or he have depressive disorder due to another medical condition is you have to specify if. So, with depressive features, so full criteria are not met for a major depressive disorder. So, with major depressive naman like episode, full criteria are met. So, except criterion C for a major depressive disorder if with mixed feature naman is symptoms of mania or alam niyo naman yung mania or hypomania, 'di ba? So, are also present but I do not predominate in the clinical picture approach. So, if masabi mo siya ng with mixed features, dapat yung symptoms of mania and hypermania are also present but hindi siya mag-predominate in the clinical picture. So yun, dapat kung masabi mo na you have, mayroon siyang depressive disorder due to another medical condition is dapat na-meet nyo yung mga criteria and then you specify if mayroon ba talaga siyang disruptive mode, I mean like depressive disorder due to another medical condition. Let's proceed sa causes of depressive disorder due to another medical condition. So, many medical problems can create changes in your body that cause depression. So, dito mag-cause yung depressive disorder kasi yung medical problems mo is mag-cause yun siya ng depression. So, some example of heart disease, 'di ba? Pag may heart disease ka, sometimes magkakaroon ka ng depression in this medical condition. So, stroke. So, this is one of the examples. Parkinson disease, hormone problems, and cancer. So, yun yung causes na possible na magkakaroon ng depressive disorder due to another medical condition ang isang tao. So, let's proceed sa treatment of depressive disorder due to another medical condition. So, pwede dito yung cognitive behavioral therapy. So, malay mo is yung mayroong ganito is yung, di ba, mayroon siyang medical condition and then nagkakaroon din siya ng episode ng depressive disorder. So, dapat you need someone to talk. So, kasi ang cognitive behavioral therapy is parang gina-talk mo yung isang tao na what's wrong, and na parang ginapatalk ka lang niya if ano yung mga hinanaing niya sa buhay. So, it is very important na magkaroon this is very important na treatment ang cognitive behavioral therapy. So, there are other researchers naman na nakakatulong daw ang treatment na to sa depressive disorder due to another medical condition ang psychological interventions. So the overall prognosis naman depends on the medical condition that is contributing to the depressive disorder. So let's proceed sa So comorbidity of this depressive due to another medical condition is conditions comorbid with depressive disorder due to another medical condition are those associated with medical conditions of etiological relevance. So dapat ang conditions of comorbid with depressive due to another medical conditions and mag-associate dapat siya sa medical condition. So it has been noted that delirium can occur before or along with depressive symptoms in individual with a variety of medical conditions such as Cushing disease. So the association of anxiety symptoms, usually generalized symptoms, is common in depressive disorder regardless of causes. So, yun yung depressive due to another medical condition. So, that's all of my report, and let's proceed to the reporter 2, which my co-reporter is by Nirjana Alamada. So, sana may natutunan kayo sa this disorder ay sa dysregulation, mood disorder, disruptive mood dysregulation disorder, and depressive disorder due to another medical condition. So, sana may natutunan kayo sa disorder na to. So, let's proceed sa reporter number 2.